New Brunswick has declared a province-wide outbreak of whooping cough. The disease is highly contagious, and to learn more about this, we've got the CBC's Linda Ward standing by. Linda, tell us more about this specific outbreak and who's been affected so far.
Right, so Abby, about 2 months ago, there was an outbreak declared, but just on the Acadian Peninsula. But because there's been a spike in the number of cases, they've now expanded that outbreak to the entire province. 141 cases have been detected, but across multiple health regions. And the average is about 34 cases per year. More than half of those new cases are outside of where that first outbreak occurred, the Acadian Peninsula and the Bathurst region. Now, this isn't the first spike that we've seen in Canada recently. There have been some localized spikes in several provinces over the last few months, and there has also been an international spike in Europe mainly. Health Canada says in a statement today, pertussis, also whooping cough, is a cyclical disease, and as such, there are years in Canada and across the world where there are more cases reported than others. Pertussis activity generally increases every 2 to 5 years, with cases in Canada generally ranging from about 500 to 4,500 annually. That is a pretty large scope. So you can see there are some years where there'd be a high number of cases and some where there would be a low. They say this year they are sort of expecting increased pertussis activity because there had been so few cases during COVID. And COVID is also complicating matters here as well, because they say vaccine hesitancy that came out of COVID and perhaps clinics that were closed and people being reluctant to go out to those clinics during COVID meant a lot of people weren't getting vaccinated.
Linda, we've had outbreaks in this country before. What are people being told to do this time? Right,
so pull out those vaccine cards and see if you are, in fact, actually vaccinated against pertussis, against whooping cough, especially for expectant parents, people who are around small children, babies. Expectant mothers are being told in their third trimester to get a booster shot. New Brunswick's acting medical officer of health says specifically because of who they're seeing getting this illness right now, it's really important that they get ahead of this before the end of summer.
We certainly want to encourage folks to check their immunizations and make sure they're up to date, especially as we're going into the school year. We want to encourage parents to make sure their kids are up to date. We've seen cases across all age groups here in New Brunswick so far. Our biggest numbers have been in our 10 to 19-year age groups. So those are our kids that are going back to school. And so to try and limit the spread that may happen there, we want to encourage kids to be up to date.
Because, of course, this is very highly contagious. It's spread from droplets from the nose, mouth, throat. So when you're looking for symptoms of whooping cough, they say it starts with what looks like a cold, and then you get a bit of a cough, and over several weeks, it sort of gets worse and worse. And then eventually the cough gets so bad that you're sort of gasping for air, and there's that whooping sound. We actually have found sound that was on Health Canada's website of what it sounds like. It's a little hard to describe, so let's take a listen to that. So yeah, definitely not something that sounds great. It sounds very serious. You don't want to get it. My sister actually had this as an adult, and I'm going to tell you, it was really awful to listen to. So the good news, though, is that if you do catch it early enough, it's great to get those antibiotics. Antibiotics are the treatment for it, and it does reduce the amount of time that you are contagious, as well as how long you're going to suffer with this illness.
Thanks for this, Linda. That's the CBC's Linda Ward.